Professor of Cardiology and HOD in the Nizam's Institute of Medical Sciences, Hyderabad. Today, the interesting topic is on the spontaneous coronary artery dissection, especially in the females. As we know that the SCAD is one of the important features which can present as a acute coronary syndrome. This is more frequent in the females than in the males, especially during the pregnancy. Not only during the pregnancy, even at the below 40 years of age, when an acute coronary syndrome patients more likely to have a SCAD in a female patient than in the male patients. In addition to the pregnancy, there are the few more risk factors for the SCAD, like an alcoholic consumption and a few of the collagen vascular diseases and accelerated hypertension. So the most important thing is when to suspect the SCAD. The SCAD cases will present exactly like acute coronary syndromes. By the clinical manifestations, we can't distinguish a SCAD from the other acute coronary syndromes. But high suspicion of index of suspicion is an important to diagnose and suspect the SCAD. Major thing is why we have to suspect about the SCAD is management is different. When you suspect a SCAD, it is better not to thrombolize these patients, especially in a pregnant ladies where the invasive coronary angiogram is relatively contraindicated, and many doctors, when the patient comes with an acute coronary syndromes, will hesitate to take in invasive procedures to manage them. There, all the more reason the SCAD has to be suspected and not to thrombolize, and directly instead of waiting, we should go for the coronary angiogram and confirm it. And always it is not possible that we can confirm by the coronary angiogram, which give a suspicion of the filling defects of the flap, but confirmation is by the intravascular imaging. Either we use the OCT, that is optical coherence tomography, or intravascular ultrasound. That is required for the confirmation. Once we confirm the SCAD, we have to decide whether to go for a medical management or an intervention procedure. The major problem with the SCAD, even though it is confined to some segment initially, subsequently, whenever we start putting the stents, the dissection may extend more distally and multiple stent implantations may be required. So we have to classify them as the low risk and high risk category groups. So whenever the patient presents with the suspected SCAD and hemodynamically stable and there is no mechanical complications are occurring and there is no cardiogenic shock, then better to go for the medical management. If opposite to that, if the patient is hemodynamically unstable and ongoing ischemia is documented by the chest pain and ECG and echocardiographic significant regional wall motion abnormality with a LV dysfunction, then it may be advisable to go for the PCR. But always we have to remember that the SCAD patients, if the PCA fails, CABCA should be one of the important options. And during the PCI, as I already mentioned, we have to pay attention to the extension of the dissection to be the same. And there are chances of the recurrence of the SCAD in a subsequent pregnancies. So these people require a monitoring in the subsequent pregnancies or subsequent events. So if you think that what is an important things that has to remember in the SCAD, or otherwise to say as a take-home message points, the females are more prone for the SCAD. The second one is clinical presentation. The SCAD may be like acute coronary syndromes, which is not different from the routine ACS management. Third one is high index of suspicion is required before the invasive procedure itself, as this will alter the management. Fourth one, intracoronary imaging is a mandatory. A fifth one, medical management in the low risk patients is the preferred one. Sixth one is during the PCI, extension of the dissection is to be monitored, and more extensive dissections that occurred, then probably we have to consider for the CABG. Last one is this, there is chances of the recurrence of SCAD, especially if it occurs during the pregnancy. So the SCAD management differs from an ACS. Please pay attention for the SCAD. Thank you.